Astaxanthin is a red pigment found in fish, shrimps, and some microalgae. It's a potent antioxidant that may help with skin aging, cardiovascular risks, protect the brain, and modulate the immune system. Astaxanthin is a naturally occurring orange-red pigment carotenoid found in algae, shrimp, lobsters, and crabs. Astaxanthin is made by green microalgae. The green algae make high amounts of this antioxidant pigment when exposed to unfavorable conditions, such as high UV light exposure, in order to reduce the damage from free radicals. Animals that eat these microalgae or yeasts take up the astaxanthin. This explains why wild shrimp, lobsters, crabs, and salmon have bright red-orange colors. Wild salmon can contain anywhere from 26 to 38 milligrams of astaxanthin per kg of body weight, whereas farmed Atlantic salmon typically only have 6 to 8 milligrams. Although it's a carotenoid, astaxanthin is not converted to vitamin A in the human body. Like other carotenoids, astaxanthin has self-limited oral absorption. Very high doses of up to 465 milligrams per kg per day cause no toxicity signs in rats. Astaxanthin is a highly fat-soluble substance, which means that it's better absorbed when it's consumed with fat. When astaxanthin is ingested, it's digested and absorbed in a similar manner as fat. It's assembled into chylomicrons. These chylomicrons are absorbed into lymph circulation before remnants of astaxanthin are digested by lipoprotein lipases. Astaxanthin is then assimilated into lipoprotein particles that get transported into the tissues. This means that astaxanthin can more readily affect the metabolism of fat and cholesterol, especially when it relates to cardiovascular health. In rats, ingested astaxanthin was metabolized by first-pass liver metabolism, primarily by the CYP450 enzyme. Astaxanthin has been identified in most tissues, but not in the heart. Some benefits of astaxanthin include antioxidant and immunomodulatory effect. It may protect the skin. It may help with exercise fatigue. It may reduce the risk of heart disease. It may protect the brain, and there's very few adverse effects reported. As an antioxidant, astaxanthin is 10 times stronger than zeaxanthin, lutein, and beta-carotene, and 100 times stronger than vitamin E. The structure of astaxanthin allows it to enter cell membranes or stay outside of the cell membranes, allowing it to protect cell membranes from both the inside and the outside. In a small trial on 30 women and 36 men, a treatment combining oral and topical astaxanthin reduced wrinkles and age spots while improving skin elasticity, texture, and moisture. Oral astaxanthin alone had similar effects in another trial on 34 middle-aged people. Supplementing with astaxanthin and collagen improves skin elasticity and integrity while reducing the production of 2 proteins that break down collagen in response to UV radiation in a clinical trial on 44 healthy people. In another trial on 23 people, oral astaxanthin reduced skin redness and loss of moisture after UV irradiation, while also improving its texture. In mice, astaxanthin prevented skin thickening, collagen reduction, and melanin production in response to UV. In skin cells exposed to UVA radiation, astaxanthin reduced the induced production of 2 proteins that break down collagen and a pro-inflammatory cytokine. This suggests that astaxanthin could protect against UVA-induced skin photoaging, such as sagging and wrinkles. In a small trial on 21 cyclists, oral astaxanthin improved power output and time trial performance. In a clinical trial on 40 male soccer players, oral astaxanthin improved the antioxidant status by increasing the activity of an antioxidant enzyme. Similarly, another trial on 32 male soccer players found that supplementation with astaxanthin improved antioxidant status and reduced muscle damage after the exercise. The antioxidant effect of astaxanthin significantly delayed exhaustion in a forced swimming test in rats. In dogs, eating a protein bar with astaxanthin immediately after physical exercise increased the glycogen and protein production, thus helping to replenish their energy stores. In a clinical trial on 27 overweight people, supplementation with astaxanthin lowered bad cholesterol and oxidative damage, possibly reducing the risk of clogged arteries. Similarly, oral astaxanthin reduced LDL oxidation in a clinical trial on healthy volunteers. In another trial on 61 people with mildly high blood fat levels, astaxanthin reduced triglycerides while increasing the good HDL cholesterol and a protein that promotes fat breakdown called adipocytin. In mice, astaxanthin delayed and reduced blood clotting in the blood vessels while increasing blood flow. In rats, rabbits and dogs, pre-treatment with synthetic astaxanthin reduced the damage caused by heart attacks in heart tissue. Blood isolated from 20 people given astaxanthin showed reduced blood clotting markers, suggesting it may help prevent heart disease from blood clots. In rats, rabbits and dogs, a pre-treatment with synthetic astaxanthin reduced the damage caused by heart attacks in heart tissue. Blood isolated from 20 people given astaxanthin showed reduced blood clotting markers, suggesting that it may help to prevent heart disease and blood clots. In 2 clinical trials on 45 people, supplementation with the antioxidant astaxanthin and sesamin reduced mental fatigue and improved cognitive functions related to the ability to comprehend and perform complex tasks quickly and accurately. Astaxanthin improved the antioxidant status of red blood cells in a small trial on 30 middle-aged and elderly people. This resulted in a reduced buildup of oxidized fats in their cell membranes, which is a risk factor for developing dementia. In rats, it delayed brain aging by reducing oxidative damage and increasing the levels of a protein that promotes the birth of new brain cells. In a clinical trial on 44 people with type 2 diabetes, supplementation with astaxanthin for 8 weeks improved blood sugar control, improved blood fat profile, and lowered blood pressure. Similarly, astaxanthin improved insulin sensitivity in rats and mice on a high-fat, high-sugar diet. Generally, high blood sugar causes high levels of oxidative stress in diabetic patients. Astaxanthin can protect the pancreatic beta cells from oxidative stress that's caused by the high blood sugar, as was seen in diabetic mice. It also reduced cell damage due to glucose-induced oxidative stress in brain and kidney cells, suggesting that it may prevent diabetic neuropathy and nephropathy. In a pilot trial on 12 people with non-alcoholic fatty liver disease, supplementation with astaxanthin had no effect on liver function or sugar and fat metabolism, but it reduced fat buildup in the liver. In the same study, astaxanthin was more effective than vitamin E at preventing and improving fatty liver in mice that were fed a high-fat diet. It also reduced fat buildup, liver inflammation, and tissue scars. Supplementing with 2 milligrams of astaxanthin for 8 weeks enhanced immune response and reduced the production of an inflammatory marker, CRP, in a clinical trial on 42 young, healthy women. Astaxanthin supplementation enhanced antibody production and decreased immune response in older animals. Combined astaxanthin and fish oil supplements modulated lymphocyte function in rats. Cell extracts of the astaxanthin-containing algae significantly reduced the number of H. pylori and stomach inflammation in H. pylori infected mice. Mice pre-treated with astaxanthin before ulcer induction had significantly fewer stomach ulcers. In rats and mice with chemically induced mouth, bladder, colon, breast, and soft tissue cancer, astaxanthin inhibited tumor formation and growth. In cell-based studies, astaxanthin inhibited the growth of colon, fibrocarcinoma, breast and prostate cancer cells, and embryonic fibroblasts by activating tumor suppressor genes such as p53. Beneficial results have been observed at 2 milligrams in humans, with dose-dependent effects at increased doses. No signs of toxicity were found at very high doses of over 500 milligrams per kg of body weight in mice. I take 12 milligrams of astaxanthin with dinner each day. I exercise in the morning, and antioxidants taken at the same time as exercise can reduce the necessary inflammation needed for muscle growth. Therefore, taking them with dinner can speed up the recovery without reducing the muscle growth. Check out my videos on antioxidants like CoQ10, alpha-lipoic acid, and glutathione, and my videos on antioxidants and their links to inflammation and autoimmune disease.